I am going to talk about new normal in post-COVID times, the cardiology perspective. So, the COVID-19, which is caused by SARS-CoV-2 virus, is raging throughout the world in all the countries. So, it affected about 70 million people throughout the world and caused about a million deaths. So the virus affects not only the healthy population but also all the people who are having comorbidities, including cardiovascular conditions. This virus affects persons with cardiovascular disease very seriously, and they also develop serious cardiovascular illness, leading to worsening of the pre-existing disease, development of new cardiovascular complications in persons with COVID-19. So, persons who are already having cardiovascular disease has to be very careful in this COVID-19 pandemic. So, I am going to talk to you about three things. Number one, what are all the regular precautions we have to take while dealing with COVID-19 pandemic. Second, what the persons with cardiovascular disease has to do in the time of COVID-19 outbreak. Third is maintaining a healthy cardiovascular lifestyle in this COVID times. So first thing, I am going to talk about the precautions persons with cardiovascular disease has to take in this pandemic. That is the regular one, that is wearing a mask, which is very important for all persons, including persons with cardiovascular disease. This is because it reduces the transmission of COVID-19 and also it reduces the incidence of development of COVID-19 in these patients. So mask wearing should be a mandatory procedure, and mask should not only be wear outside the home but also inside the home, which is very important in these high-risk persons, because these persons, when they are exposed to household members who are having asymptomatic COVID infection, they are more prone to develop this COVID-19. So second is maintaining of social distancing. As everyone knows that maintaining of social distancing of about 6 feet is very important to decrease the incidence and the transmission of this virus. So they have to be avoid all crowded areas, it's not only indoors but also in outdoors. Second, they should avoid all closed areas without ventilations, which are very important because these crowded areas without ventilation are more prone for developing the transmission of the virus. So they should avoid the crowded as well as the closed areas. Third one is they should avoid close contact with person, either with family members or with outsiders, non-family members. They should always maintain a social distancing. So crowded areas, closed contacts, and closed spaces, all the three are very important for avoiding the transmission of this COVID-19. That they should always follow. And the fourth one is the frequent hand washing that everybody knows. They should hand wash before eating food, after going to the restroom, and before coming from outside into the home. These are the times they should hand wash frequently. And these are all the general precautions they have to take in this COVID era. Second is the taking care of the disease, which is very important. So in these times, most of the persons who are having cardiovascular disease are avoiding healthcare disease, which is very dangerous. They should undergo a regular maintenance of healthcare visits should be undertaken. So they should not fear about catching the coronavirus when they visit the healthcare facility, because once they avoid this maintenance of the healthcare visits, they can develop a serious illness, either in a development of new illness or the worsening of the pre-existing disease. So they should have their regular maintenance visit to the healthcare facility, and they should contact their healthcare provider either through a teleconsultation, so that minor dose adjustments and minor ailments can be treated through teleconsultations. Other than that, they have to, the healthcare provider wants the patients in person, they should visit the cardiologist and they should have a checkup. And the third thing is all emergency cardiovascular procedures are done in all hospitals 24/7, and they should not afraid when they have an either an acute cardiovascular illness, including all emergency. The patient have a chest pain or a sudden shortness of breath, they should definitely visit the emergency department, so that they should not have missed the cardiovascular illness, which is very dangerous. Sometimes also it will lead to increased incidence of death among patients with cardiovascular illness. So this is a very important one, and whenever they go to a healthcare facility, they should take adequate precautions such as wearing a mask, maintaining social distancing in the reception area, and they should have a frequent hand washing before entering as well as leaving the healthcare facilities. And these precautions, if they take, there is no need to worry about visiting the healthcare facility. The third one I want to share with them is maintaining a healthy cardiovascular lifestyle in a COVID pandemic. That you all know that patients should have a regular healthy diet, which includes lot of fresh fruits, fresh vegetables, which increases the immunity power, and also they prevent the worsening of disease. They should avoid starch-containing foods, plenty of oils, junk foods, all these things which are harmful to them, and they should go for a regular walking. So walking, either they can do inside the home, either using a treadmill, or they can have a walk around their home. They can also go to a nearby park or a open playground like that area, which are very safe. They can wear a mask, maintain social distancing from other persons who are using the same park or the same open area. That is very important, and they can safely maintain their exercise routine. Fourth one is they should get an adequate sleep, and fifth is they should take their medication regularly. They should not skip their medications. Patients who are already having the cardiovascular disease should not skip their medications, because skipping their medications can lead to worsening of the disease, sometimes a worse outcome also. So they should have adequate stocks of all the cardiovascular medications, and they should take it regularly. They have any doubt about the dose adjustment, development of side effects for these cardiovascular medications, they can contact their cardiologist either through a teleconsultation approach first, and they can make minor adjustment. If it is not possible, they can visit the healthcare provider. These precautions, if they take during this pandemic, help them to overcome this pandemic, and also they can lead a healthy, normal lifestyle by taking care of their cardiovascular disease. I wish you a healthy, hard day, and I am wishing you all of them to have a wonderful, healthy heart.